I'm Harry Forrestel in Fredericton, where the number of people infected with COVID-19 continued its relentless climb today. 4 more cases for a provincial total of 95. Now, New Brunswick has the second largest population in the region, but remarkably no deaths here yet, although health officials say they will be inevitable. Across the border, Nova Scotia leads the region with 207 cases, 14 of those added today. Most of those cases are travel related, but there are growing concerns about community transmission in Nova Scotia. PEI added no new cases today. It has 22 infections. And finally, Newfoundland and Labrador added 12 new cases for a total of 195. And the region's only death from COVID-19. Newfoundland and Labrador says it won't be able to do the modeling that will indicate when the COVID surge will hit. The other 3 provinces here have committed to doing that next week.
I'm Alison Northcott in Montreal, the epicenter of the Quebec outbreak. The province leads the country with more than 6,000 confirmed cases. That's in part because of more testing here. But there are more than 400 people in hospital, more than 100 in intensive care, and 61 people have died. Quebec's premier says he'll reveal projections for the outbreak next Tuesday.
We have to give the population the information we have. But until now, the information was not clear about the number of cases, the number of deaths that we forecast in the next months or even in the next weeks.
Legault says the measures in place so far are working, urging people to follow directives around staying home, physical distancing, and hand washing. He says hundreds, even thousands of lives depend on it.
I'm Bonnie Allen in Regina, and here in Saskatchewan, 3 people have died from the virus so far. And at the moment, fortunately, just 1 person is in intensive care. The province is still calculating what to expect, so for now, all we can go on is an internal report from 2 weeks ago. It predicted a worst-case scenario of hundreds of people in the ICU at one time, and as many as 15,000 people in Saskatchewan dying. But that prediction was made before most restrictions came into effect. Next door, Manitoba's premier says he'll release some information next week, even though he's reluctant to do so.
I'm not interested in trying to scare the hell out of everybody in the province just so that some people start to pay attention.
COVID-19 cases in the ICU remain low in the West. Alberta is still tweaking its calculations, but we already know it projects 250 people with the virus will be in ICU beds within 3 weeks, and it will have 1,200 beds ready.
Well, for some analysis, we're joined by our medical sciences correspondent, Kelly Crow. And Kelly, what do you think the strategy was behind releasing these projections?
Well, I think there were 2 objectives. I think the first was, frankly, to scare people. The language being used was that these are stark numbers, it's alarming. We had 24 hours notice that we were going to hear something disturbing. And I think the purpose behind that was to get people who might not be taking this seriously to be serious and to actually understand why these physical distancing measures are being put in place and to actually follow through. But at the same time, I think there was also an effort to give some positive feedback, to say, look, this is what could happen, but this is what will happen under, or what are projected to happen under the measures that are in place right now. So a way of saying, keep doing what you're doing, but what you're doing is hard, but it's actually having some impact.
And we keep hearing about the peak and, you know, how important it is to try to keep that peak below what hospitals can manage. Do we have any sense of when we're going to see the peak?
Well, there's so many variables at play here. So I think the answer is no. Although privately, some of the experts are saying that they're beginning to see early signs that we might see the curve flattening, but it will be flattening over a long time. We're going to have to keep these physical distancing measures in place for quite a while. I think that maybe by the end of next week and the week after, we'll start to see whether the people returning from spring break, whether they are responsible for an increase in cases. We'll watch and see what's happening with the long-term care outbreaks. So obviously, it's a question everyone's asking, and unfortunately, the answer is we'll just have to stay tuned and keep watching.
Yeah. All right. Kelly, thank you.
Thank you.